Come in. Hi, Danielle.
Hi, it's nice to meet you.
Yes, you too. You can have a seat.
Oh, okay, thank you.
No problem. My name is Andrea Hawkins. I'm actually the hiring manager for this facility. You'll just have to see me today. I'm just going to ask you a couple questions, get to know you a little bit, and I just want to start off with, why don't you tell me a little bit about yourself?
Okay, well, I'm currently a senior BSN student at UVA-Wise. I'll be graduating in May. I've always been a caring person, so I believe that the nursing profession was meant for me. I am a quick learner, I work well with others, and I just love patient interaction.
Okay. What type of nursing experience do you have?
Okay, well, I've been privileged to work in many different clinical settings, such as multiple med-surg units, psychiatric, community, pediatrics, OB, leadership, and I was actually able to complete my preceptorship in the ER.
Oh,
all of these areas have actually allowed me to work with a diverse group of patients and expand my knowledge in nursing care.
Oh yeah, I'm sure. Are there any certifications that you have that I should be aware of?
Yes, I actually have my BLS certification.
Oh great, we love to hear that. Have there been any times that you've been able to utilize that certification, or was it just something you took a class on and never really got to use again?
Yes, I've actually utilized the BLS certification. Once on an oncology unit, a patient coded, and I assisted in performing chest compressions with other members of the healthcare team. And on the ER, many times patients coded, and I assisted in compressions and the ambu bag.
I guess I'm just gonna ask you to maybe brag on yourself a little bit, Danielle. So don't feel like you can't.
Okay.
What do you consider your main strengths?
Okay. Well, I consider my main strength to be the ability to develop an effective nurse-patient relationship.
Oh yeah.
I communicate with patients effectively, I believe, and that allows patients to open up to me about certain areas of their life or certain problems they've been having that might contribute to providing quality patient care and potentially saving their life.
Oh yeah. Good answer. I guess on the opposite side of that question, I need to ask you about an area that you believe you might need to improve on.
Okay, well, an area that I think I need to improve on is the ability to separate my feelings from my career. As a novice nurse, I feel like that is something that everyone might stumble upon and feel like it's hard to separate the two.
Of course.
But throughout all my clinical experiences, I've been working on that, and I feel like I improve every time I go to clinical. I just think that being able to separate the two is important for the client, because as a nurse, you need to be the rock for the client.
Agreed.
And compassionate as well.
Okay, moving forward, I'd just like you to tell me about a time in which you had to deal with a difficult person, whether it be a physician, a coworker, a patient, and kind of what you did to deal with that situation.
Okay, well, I was on a dialysis unit once,
Okay.
and a patient had been admitted because he was non-compliant to his entire medication regimen, any type of regimen. And he was on 6 liters of oxygen, he was obese, and he was one of these patients that rang the call light every 5 minutes.
Okay.
But as a nurse, you're always supposed to respond to that. So the nurse I was with and I, when he rang it once, we went to go see what he needed, and he needed back up in bed. So the nurse and I were helping him. However, he wasn't assisting us at all, like all the weight was on us. And in that process, he started hyperventilating and appeared to be having a panic attack.
Goodness.
So the nurse and I just calmly stepped back, and we reminded him that we were there for him and to take a few deep breaths, to take his time, and that we would eventually get him back up in bed. So within a few minutes, he had calmed down, and he actually helped us get him back up in bed. So there was an improvement, and throughout the rest of the day, he was compliant, he was willing to let us implement interventions, and I really think that interaction helped with the rest of the day that we had with him.
I bet it did help. I just want to ask you, Danielle, where exactly do you see yourself in 5 years?
Okay, well, in 5 years, I plan on expanding and broadening my nursing knowledge. I want to get my master's or even doctorate and become a nurse practitioner.
Oh, that's great. That's great to hear. And in wrapping this up, I know it's a topic that nobody likes to really mention, but we have to talk about it. What type of salary are you looking for?
Okay, well, I'm not really concerned with salary as much as I am providing quality patient care. I'm here to fulfill the job description. But I have researched your all's starting salary, and I found it to be about $18.50, and I feel like that is a reasonable salary for a beginning nurse.
Okay, great. Well, Danielle, that concludes all the questions that I have for you today. At this time, I would like to thank you again for coming in.
Thank you for allowing me to have this experience.
Not a problem at all. We were excited to meet with you, but at this time, I'd also like to ask if you have any questions for me.
Well, before I ask any questions, I'm going to go ahead and give you my professional portfolio before I forget.
Oh, yeah, great.
It has my cover letter, my resume, and a table of contents explaining what else is on there.
Okay, great. Thank you.
So, since we just talked about salary, I want to ask if there's a BSN differential.
Good question. I don't have a lot of new nurses ask that question. I think they forget. We do offer $1 extra on the hour for BSN students.
Okay. And what about the healthcare benefits?
I'm not an expert in that department, but I can tell you that I will be sending you home with a packet today that's going to have descriptions of all the options that we have. We do offer health coverage, dental, eye care, and are you married or single?
I'm single.
Okay, well, if you were to have a family, we have a package that would describe that as well. So there are a couple different options in here you'll have to look over. We have somebody in a different department. There's contact information inside if you do have any questions. I'll go ahead and give you this as well.
Thank you.
No problem. Is there anything else?
Yes, just switching the topic a bit. What about the nurse-to-patient ratio?
It really depends on what department you're placed in. Say med-surg unit, it's usually no more than 7 patients to a nurse. I mean, I know 7 sounds like a lot, but that doesn't really happen a lot. It's normally about 5 or 6 patients to one nurse. Moving to other units, maybe a critical care unit, an ICU, cardiac ICU, it'd be more like 1 or 2 patients for a nurse. You mentioned you have some experience in the ER. Our ER nurses are usually, depending on staffing that day, they're usually in charge of 3 rooms, so 3 patients.
Okay. What about assistive staff to help nurses on the unit?
We do. We have a supportive staff that comes in. We have a variety of people. We've got LPNs. We've got PCTs, patient care technicians, and those people are there to help the nurse. It's really important that you develop your delegation skills because you are in charge whenever you're the nurse of determining what you need help with, what you can do, how you manage your time, and kind of knowing their scope of practice as well, knowing what they can and can't do for you.
Okay.
We also have some volunteers that come in and help. We've got people that come in and donate meals, and all those people will have descriptive badges on, so you'll know who those people are as well.
Okay. What about nurses putting in their opinions to make differences in the unit or just the facility overall?
Well, that's a great question. I'm really glad you asked that. We pride ourselves in knowing how our nurses feel and their opinions. You all are the ones that are there with the patient, so we take a great deal into considering how the nurse feels, the opinions she may have, the suggestions that she or he puts in, I'm sorry. But we always ask our nurses before we make any decisions.
Okay. And what about some professional programs offered to nurses, such as continuing education or ACLS?
Well, we love to see our employees better themselves, whether it be for our benefit or theirs. So we do offer a lot of in-house training, such you mentioned that you're certified in BLS. Well, we have in-house ACLS training. We've got programs to help you better read an EKG, maybe if you're interested in OB, fetal heart monitoring classes. We've got classes that you'll go through orientation and learn more about our computer systems, our medication administration programs. We've got a lot of in-house things that really help our nurses out. We also do have some programs that are offered with schools in the surrounding areas about helping nurses continue their education, whether it be to gain your nurse practitioner's license, your doctorate, your master's, etc., etc.
Okay. Well, I think that's all the questions I have for you. So.
Okay, well, I really appreciate you coming in, Danielle.
Well, thank you so much for providing me with this opportunity. I really appreciate it.
You're welcome, you're welcome.
And I look forward to the opportunity of talking to you again.
Yes, you should. Thank you.
Thank you. Have a nice day.
You too.